This segment is sponsored by the District of Columbia's Department of Behavioral Health. We're currently experiencing a drug overdose epidemic across the nation, and D.C. has some of the highest overdose rates in the country. I spoke with the director of the Department of Behavioral Health, Dr. Barbara Bazron, to see what steps officials in the district are taking to reverse this trend. Dr. Bazron, thank you so much for speaking with us today.
It's my pleasure.
Thank you. Well, today is International Overdose Awareness Day. Can you tell us a little bit about this day and the work that your agency is doing?
Certainly. International Overdose Awareness Day is an opportunity to make district residents aware of the risk of illegal drugs and how they can help address this issue with their friends, with their families, or their loved ones. Overdose deaths are preventable. Effective treatment is available. And on this day, it's really important that we remember the people who've lost their lives as a result of the disease of addiction. Street drugs have never, ever been more dangerous in the district and nationwide. 99% of the overdose deaths in the district involve fentanyl. We're seeing fentanyl in most common street drugs, including heroin, cocaine, meth, and other drugs. In addition, a new deadly addictive drug called xylazine, also known as tranq on the street, is emerging in other cities. And we're monitoring closely here in the district to see if it emerges.
Well, you mentioned that overdose deaths are preventable. Can you speak a little bit to the harm reduction efforts that the district has in place?
Sure. First of all, I'd like to say that the goal of harm reduction is to keep people alive. We have naloxone, which is here. Naloxone is a life-saving drug that can be easily applied when somebody overdoses. You apply it through a nasal spray. It's a plunger that can be applied to someone who is experiencing an overdose. However, one of the things that I do want to make sure that people are aware of is if you see someone who's having an overdose, the first thing you do is call 911. It is a medical emergency. Then you can administer naloxone. There are instructions on the package that say how to appropriately administer the drug. In addition to that, we also have fentanyl test strips. We have 7 vending machines which are located throughout the community. We have 4 that are outside of fire stations within our community, and within the vending machines you have fentanyl test strips, you have naloxone, and you also have wound care supplies.
What treatment options are currently available?
We have a wide variety of treatment options available within the districts of Columbia. We have a comprehensive system of care to support individuals with substance use disorder. This includes 29 substance use disorder clinics, and of those, 11 not only are certified to treat substance use, but they are also certified to treat mental health disorders. And so we have a co-occurring opportunity to provide support for individuals. The other thing that's important is we have medication-assisted treatment, which is really needed to help manage the cravings and treat addiction. Currently, MAT is available in all 8 of our FQHCs, or our federally qualified health centers, doctor's offices throughout the District of Columbia. We also have 3 methadone clinics that are available for our residents. One on Good Hope Road, one on the DC General campus, and one near George Washington University. The other thing that I think individuals who are in treatment or interested in treatment should know is that we also provide free transportation for individuals so that they can get to counseling or their treatment appointments. It's free of charge. And then we also have recovery housing.
Text Live Long DC to 888-811 for pickup locations for naloxone and test strips. You can also request for naloxone to be delivered directly to you.